And so now we're going to, we were discussing the older end of our population, and now we're going to be moving down to more of the younger end. And our Vice President of Research, Marnie Werner, has been working with the Center for Rural Behavioral Health from Minnesota State University, Mankato, for a few years. And they have been such a great partner with the research and with the work, and we're really excited for their future of opening a new clinic. But I'm going to turn it over to Marnie to discuss accessing youth mental health services. And again, if you have questions, please put them in the chat.
Okay, thanks. Yeah, and like Julie said, I'm Marnie Werner. I'm the Vice President of Research at the Center. And we have been looking at mental health now for the last 2 or 3 years, and we've been working with the new Center for Rural Behavioral Health at Minnesota State Mankato, and they have been great partners with us. This is either our 3rd or 4th report, Accessing Youth Mental Health Services. We released this report last fall. And when we ran this question through our research agenda survey, this was the top scoring question, and it was probably the highest response we've ever had to a question. So we know that this is an issue that everybody's very concerned about. And yeah, things are going well in rural Minnesota, but like the rest of the country and even a lot of the Western world, we have a lot of people who are experiencing mental health issues, and that's especially true for our kids. And so if you take a look at this first chart here, a good indication of that is cases of self-harm. This is cases of self-harm among U.S. adolescents aged 10 to 19 per 100,000. So this is the rate. And you can see how things were going along fairly well. The cases were even declining a little until we got to about 2009, 2010. And then especially for girls, the rates just started going up. And then in 2020, you can see that they really took off after that. And another indication is emergency room visits. These were visits for 4 major groups of mental health issues that kids can have, which is anxiety, conduct disorders, depression, and suicidal ideation. And so you can see how suicidal ideation went up, especially amongst girls. And it may look like the others are going down, but this chart is just showing the ones that were checked off as the primary reason for the visit. So maybe in the past, these other conditions were checked off as the first, as the primary, but now in more and more cases, it's getting to be suicidal ideation, and the others may be on there as secondary or tertiary conditions. And so the big question, this was our research question, where do rural parents get help for their kids? It's a big, broad question, but as you look at the issue of workforce shortages, which we covered in another report earlier, and just the difficulty of accessing mental health services, the long waiting lists and the long distances to drive to get to places, this was very much a pertinent question, so we wanted to see what we could find out that parents could do now to help their kids while the big issue is being worked on. And of course, that big issue is the workforce shortage. This is the issue with just about everything right now in rural areas. There is such a shortage of mental health workforce, and that has to do with the whole pipeline from entering the programs to graduating to getting licensed. Right now, a lot of experienced professionals and providers are retiring. A lot of them are over 55. There's difficulty recruiting more people into the field. There's difficulty getting people licensed after graduation. And there's difficulty getting people to rural areas. And so a lot of people, a lot of agencies are working on this, but it takes time because to get through the whole process takes at least 4 years and even longer to get a person from start to finish. So what can we do right now? These were the 3 things that we came up with the report. And of course, you can read the full report on our website at ruralmn.org. But we'll just go over the 3 things that really popped out as things that we can do now to help our kids. And I think the first one for parents right now is to educate yourself about children's mental health. What is mental health and what is mental illness and what is it not, especially for children. Children their mental health issues show up differently than they do in adults. And children aren't able to express they aren't able to express their emotions as in the same way that adults can. They can't just sit and tell you about what's going on in their heads because their brains haven't developed to be able to do that yet. And so you need different kinds of conversations or things like play therapy or art therapy to really help them express what's going on. And so those are, important things you can learn about mental health, and there are a lot of good sites. I mentioned some websites here: Minnesota Department of Health, NAMI Minnesota, which is the National Association for Mental Illness Minnesota branch, and the Minnesota Association for Children's Mental Health are some of the sites that have really good, reliable, trustworthy information there where you can learn more about this. Getting help earlier for your children is really important. Early intervention is so important. And it can keep things from getting worse. It can help keep symptoms milder and help them recover sooner. Using 988 as a mental health resource is a great opportunity we have now. We still kind of out of habit call it the suicide line, but it's actually for everything mental health. If you have a question, if you're concerned about someone, you can call 988, and there are people in Minnesota, even maybe in your region, who you can talk to, and it's all anonymous. You can learn about the risk factors and protective factors, and we'll talk about that a little bit in a second. And then look more into research on social media. There is more and more research coming out now about the negative impacts that social media has, especially on children and young adults. And so that's a good place to start too. And so, we already went through this slide. We'll move on. Okay, so this is where we're talking about early intervention, and this is so important. On the left side is kind of where you start, promotion and prevention. So that's promoting good mental health. Screening and the protective factors, we'll talk about that. CTSS is certified, I looked it up and now I don't remember what it stands for. But it's an array of services, mental health services that the state has approved. And it's all different kinds of therapy and things. And these would be things like your family support, your local mental health center, private clinics and things like that, where your doctor or your mental health provider may recommend. School-linked mental health services. We'll talk about this more, but a lot of schools already have mental health providers in the school and therapists right there, and that's been a big help to schools and to kids. Crisis intervention is a service where if your child is having a mental health crisis, every county has a crisis phone number, and there are mobile crisis teams all over the state that can come in and help de-escalate the situation right there in your home. Then you get to the more intensive mental health services, and these are things where the child needs more help. They may need to go to a residential facility or a psychiatric residential treatment facility. And a lot of the talk in the last few years has been how we need more beds. Yes, we do need more beds, but we also need more prevention so the children's mental health symptoms, mental illness symptoms, don't get to the point where they need to go to a residential treatment facility. So that's where prevention comes in. And then just as important as the recovery and rehabilitation, when the child leaves the residential facility, they need some counseling and some help to be able to enter back into, living at home and going back to school and things like that. And so that's the continuum of care for children. And these are the risk factors, and there's a lot of words on here. You can read these later when you download the slides, but we have risk factors and protective factors. These are all part of what's called the social determinants of health. And these are things that can affect your physical health, and they can also affect your mental health. And the more of one, they compound. So if there are more risk factors, you have a larger chance of having negative health problems. If you have more protective factors, you have a better chance of overcoming problems. And protective factors can outweigh the risk factors. And so that's why it's so important to think about things like, does your child have low self-esteem? And especially if there's like multiples of these, in families where there is poor parenting or substance use, child abuse, these can all be risk factors for mental health issues later. Schools in communities where there's a lot of violence or poverty or traumatic events or drug use in school, those are all risk factors. The protective factors are just what you would expect. They're just the opposite. Your child has learned emotional self-regulation, coping skills. They're engaged at school. They're engaged with their peers or at their, at their church or wherever their religion, their house of worship is. They're engaged with their culture. The family provides structure, supportive relationships with family members, and clear expectations of behavior and values. And things like opportunities for engagement in school and the community. Those are all protective factors that can help outweigh the negative risk factors. And so those are all really good things to know and understand. And so here's the second thing that we found that was really interesting, was consulting your regular doctor. Well, you think, oh, the doctor's only for physical health. Well, it's still important, if you're concerned about your child's mental health, to take him or her to their regular doctor, because first of all, the doctor can see if the issue is maybe physical. There may be, heaven forbid, a brain tumor or something like that. It may be a vitamin deficiency that's causing odd behavior. But the doctor can also determine then maybe it is a mental health issue. Doctors, family practice doctors, can treat non-complex cases like depression or anxiety disorder. And there are some family practice doctors that are reluctant to treat mental illnesses because they feel like they haven't gotten enough of the training for that. But really the trend is getting more and more towards integrating mental health services into the regular clinic, and the doctors are getting more and more familiar with it. And so behavioral health integration, that's what that trend is called now. There are more and more clinics now that are actually bringing their mental health providers, their therapists, into the regular family practice clinic. And that's been really important because in this case, the doctor can say, well, it seems like, maybe this has been just a really stressful time for you. Maybe it would help if you talked with Rachel about, the way you're feeling, the way this is making you feel. They can couch it in a way that can make it not intimidating for a person and not scary for a person. And then they can call in that therapist and have that person come right into the room there, and the three of you can talk together. And it makes it much less scary, much less intimidating. Being able to go and see a provider, a mental health provider, at your regular clinic helps keep things anonymous. If you're concerned about what everybody in your town will think if they see you going to the mental health clinic, if you can go to your regular clinic, then nobody needs to know what's going on. And then the warm handoff is really a great way to make a personal connection right away with the therapist. And it makes things a lot more comfortable, especially for your kids. If they can meet the person right now, it makes it a lot less scary for both the kids and the parents. And that's why the warm handoff is so important. And then the third thing is mental health services at school. Most Minnesota school districts now have therapists in their schools, and they're available by telehealth. This has been a big move that the state legislature has been funding in the last few years, and the school districts have been getting on board with. And that's been a real help, because school is, kids spend a lot of time at school. It's a place they're familiar with. It's much easier for them to meet with their therapists there. And the therapists can help keep things anonymous. They figure out ways, that the child can make their appointment and nobody needs to know what's going on. A big problem for parents who need to take their children to a therapist is that the clinic may be in another town. And so they may have to take off half a day or a whole day of work to take their child to that appointment. And if they need to do that once a week for, maybe 20 weeks, that gets to be a real problem for the parent. And so having the therapist at school, it really helps those parents out. They don't need to take that time off. And it really helps with what is a major issue in rural areas. And then providers really work to stay connected to the clients' families. They bring the parents in or the whole families in periodically to talk with them and just see how things are going, and just to keep everybody in the loop and everybody connected. And so these are the major takeaways for this report. And they were that children's mental health has been deteriorating for at least the last 10 years, and the pandemic made things worse. And accessing mental health services in rural areas has its own set of challenges: distance and transportation, conflict with parents' jobs, concerns about anonymity and long waiting lists. There are 3 opportunities that we just went over to help parents educate yourself on what children's mental health is and isn't. Talk to your child's regular doctor and talk to your child's teacher, because there's a good chance that they can already help you.